last week in IHME's updated forecasts, we certainly were trying to take into account what's unfolding in East Asia with continued rapid expansion of an Omicron epidemic in Taiwan, and that continues to expand. And then this very challenging question of how Omicron will play out in China. The government is pursuing their zero COVID strategy with lockdowns as needed. We have been expecting Omicron since February in our modeling to eventually break through these efforts because it has appeared that other control efforts on Omicron have been generally less successful around the world than for previous variants. But so far, these strict lockdown policies have kept Omicron numbers at a relatively low level. And I think it's extremely hard to understand how the policy environment will play out in China. If they pursue strict lockdowns, it's possible they will keep Omicron transmission at a relatively modest level through to the fall. But we do believe that it is inevitable that there will be a large Omicron outbreak at some point in China, because maintaining a strict zero COVID strategy is probably unsustainable as the year progresses, but essentially impossible to know when that change in policy will occur. In the US, we're seeing increases in a number of parts of the country, particularly the Northeast, some of the West Coast, in cases, hospital admissions, and this is a pattern that follows what we've seen in Europe as people's behavior goes back to pre-COVID levels, and there's a little bit of transition to BA2 and perhaps BA4 and 5 as they continue to spread. We do expect a modest increase in numbers. Our expectation is that'll peak sometime in May, early June, and then go back down. We don't expect a major surge from that. Now, there have been reports from the White House of their efforts to model on the long term a large surge in infections. And in our long range models, which we do not release publicly, we do expect in the winter a return Omicron surge. Now, of course, if there's a new highly infectious variant that's more severe, that would trump this pattern we expect. We expect a surge in the winter because of declining immunity from exposure to Omicron, as well as declining immunity from vaccination, and perhaps not as a high rate of repeat boosters as we've seen for the third dose going into the future. The consequences of a winter surge in the US should be much smaller because of Paxlovid and increasing availability of antivirals and use of antivirals. So we certainly expect quite large numbers in the winter, not so much the fall, perhaps as many as 30% of the US population getting infected through the winter with Omicron. But we expect the consequences to be much, much lower because of antivirals. And we don't expect much in the way of government mandates, given the much lower ICU admission rate and death rate that should occur with these new strategies, particularly antivirals. At the global level, there's been ongoing debate and concern about BA4 and 5 in South Africa. There's not an exponential surge there. There's a very slow increase in numbers. And we so far are not seeing any indication that BA4 and 5 could be the driver of a major global surge in cases, but of course warrants monitoring on a regular basis. So overall, in terms of general strategy globally, given we've seemingly maxed out globally on the number of people who are unvaccinated that want to be vaccinated. As far as we can tell from the data, only about 3% of the world wants a vaccination that's not received one. A lot of that is concentrated in sub-Saharan Africa, but still it's not a large percent of the population. perhaps the main strategy to deal with future variants is making sure that anyone who needs antivirals will get access to antivirals. And there's a lot in that, both in terms of production of Paxlovid and health system infrastructure and response patterns, so that when somebody needs it, they can get it, whether they're in a low resource or a high resource setting. So those are our main observations on the epidemic as it continues to unfold.